Hello. Welcome back to Caring Nurse 101. My name is Christine. I'm an RN, I'm a coach, I'm a mentor, and an educator. And I've been doing a series on the three most um, important challenges of every aspiring nurse or student. And the three challenges are academic rigors, clinical experience, and time management. We spoke about academic rigors last week, so this week we're going to speak about clinical experience. Welcome, aspiring nurses, to the heart and soul of your nursing education, and that is clinical experience. Today, we're going to dwell into the challenge that awaits you as you step into the world of hands on patient care. And hands-on patient care um, is experience. There is nothing more beneficial and more effective in nursing school than clinical experience. It's where you take the theoretical knowledge that you receive in the classroom and you apply it in um, the hospital or the facility that you may be working in. It could be a doctor's office, it could be a clinic, and then there you can also work in the hospital. Clinical rotations, a lot of times when you're in nursing school, you're going to be in a hospital setting. And then also you will be going into doctor's offices and sometimes nursing homes, but the majority of the students always rotate in the hospitals. And that's where the theory meets practice, where textbook come to life and where you'll truly begin to feel the heartbeat of nursing. Um, but let's be honest, clinical experience can be daunting. The first time you step into the patient's room, your heart may race, your palms may sweat, and your mind may feel weird with a whirlwind of emotions. And that's natural, that's normal, because you're stepping into unfamiliar environment. You've never been into a clinical settings before. And so that's normal. You just have to try to be patient and stay calm and just follow your classroom instructions and listen to what your instructor tells you. You will encounter patients from all walks of life. Some will be grateful for your care, others may be resistant or difficult. You'll witness moments of joy and triumph as well as moments of heartache and despair. And during your nursing career, each and every one of those feelings you are going to experience. It is very rewarding for a patient who's very grateful for your attention and your love and your care that you give. But then there are going to be times when there are going to be some rude, hostile, and difficult patients. But you will learn how to manage or deal with those patients during classroom settings, but nothing is more important than experiencing in a patient like that and learning from your own experience in the hospital. But amidst the challenges and complexities, clinical experience offers invaluable opportunities for growth, learning, and self-discovery. And now I'm going to give you at least a few guiding principles to help you navigate the waters of clinical experience. Number one, first embrace humility. You may not have all the answers, and that's okay. Because out of all the years that I've been a nurse, I was still learning, and I've been a nurse over 30 years, and I'm still learning today. So, of course, stepping in as a new nurse, a new student, you just know that you're not going to have all the answers, and just understand that. And once you accept that fact, then you can embrace humility. Be willing to ask questions, seek guidance, and learn from your mistakes. Number two, cultivate empathy. Behind every diagnosis, every medication, and every procedure is a human being with hopes, fears, and dreams. Treat each patient with compassion, dignity, and respect. I say always treat people the way you would want to be treated. Treat the patients in the bed in that room as if they were a loved one. Number 3, hone perfection. Your clinical skills. Try to be as perfect as possible. Of course, you're not going to be 100% perfect, but you want to work towards doing it as perfect as possible. And pay attention to detail. Practice good communication and thrive for excellence in everything you do. Thrive for excellence. You will never be perfect, but you can thrive for excellence, and that's very important. And finally, cherish the journey. Clinical experience is not just about mastering skills or fulfilling requirements. It's about forging connections, making a difference, and touching lives. And in conclusion, embrace clinical experience as a privilege, a responsibility, and a sacred trust. With courage, compassion, and a commitment to lifelong learning, you'll not only survive but thrive in the noble profession of nursing. Thank you for coming to Caring Nurses 101. I hope that helped you understand how important it is to understand the challenges of clinical experience. But if you take these tools and these principles that I just gave you on clinical experience, you should do very well. I would like for you all to go to my website, www.caringnurses101.com. Sign up and for my courses on my website, and also if you sign up and submit your email, you will get a new ebook, and also I will be giving out my ebook, this ebook, but the other ebook is a skills checklist that you need to follow. But then I'm throwing in a extra book. It is called The 10 Principles to Becoming a Successful Nurse, and it's on, I wrote several books on my website, Nursing Education and Resources, and you can also sign up for one of my courses, like I mentioned, on my website and prepare you for your nursing journey. Thank you. Have a good day, and I'll see you next week. We dive into talking about one of the most important challenges, and that is time management.